Hello there, Oluchi here. In the last video, I identified 5 factors that makes nursing practice in the developing countries different from the nursing practice in developed countries. The factors I identified are technology, which I talked about in the last video. Number 2, continuous education. Number 3, specialties. Number 4, legal issues. Number 5, patient literacy. So I covered 2 of those in the last video, that is technology and continuous education. So in this video, I'm going to cover specialties, legal issues, and patient literacy. So let's start with specialties. There is a ton of nursing specialties that are practiced here in developed countries. So the idea of specialty is to be able to do one thing very well, so that when you treat patients, you give them the best. An example of a specialty here is wound care nurses. These nurses are focused on prevention and treatment of wounds. They just specialize on wounds, and they do a very excellent job in managing wounds and preventing wounds. Other specialties are home health, oncology, case managers, nurse administrators, nurse educators, forensic nurses, hospice nurses, legal nurses. There is a bunch of them. There are so many. So with specialties, special knowledge is involved, of course. Special skill is involved, and the outcome, as you know, is excellent health care for the patient. So those opportunities exist here, and that's one thing that makes it different from our own healthcare system, where we have more of generic nurses there, general nurse, the bedside nurse. I know we have ICU nurses and dialysis nurses and all that, but these ones have specialties and subspecialties, so it makes the outcome of the healthcare or health delivered to the patients to be quality. Number 4, I believe, legal issues. So laws are taken seriously here. If a law is enacted or a policy is stated, you are required to follow it. If you break the law, you find out, you will take responsibility. As a professional, you are expected not to do any harm to the patient. So if eventually you do anything that harms the patient, you are going to face the full wrath of the law, because things are taken seriously. You don't get away with things. You find people who take pictures of patients, maybe in the theater or in care areas, and post it on social media. People take information about their patients, share it with their family and friends. So those things, if you do that and they discover it, you are going to losing your job is a small matter. There is the issue of losing your license, and then there is also the issue of going to jail for all those kind of crimes. So take note that legal issues are taken very seriously here. Then the 5th one is patient literacy. You will find patients in their 90s here who have relative health education. They know about their plan of care. They know about the medications they take. They know about what is ailing them and how it's being managed this whole time. So as a professional, you should have a fine grasp of knowledge and skills that are required for you to treat these patients, because they will ask questions and you are required to answer those questions, clarify any gray areas, and educate patients. An average geriatric patient knows the medications they are on. They know the dose. They know the side effects. They know what the drug does. So they know to question new things or new drugs or new plan of care. So you are required to answer questions when they are not clear about things. You are required to clarify their doubt. You're required to educate them about the care of plan, and then the medications, the side effects, and everything that has to do with it. I know these things take time, but I'm just stating the basic requirements. And though these things may seem like a lot at first, but just like I said, it's a process. You have to be patient with yourself. If you are confused about anything, or if there's anything that is not clear, ask questions. It's better to ask a stupid question than to make a stupid mistake. Thank you for listening. I'll see you in the next video.